your doctor prescribes for you, mainly because of avoidable side effects. And these are avoidable because the decision-making and the prescription often doesn't involve informed consent. And when you tell people the full benefits and harms in absolute terms of drugs, mostly they're more conservative, they're less likely to take the pills. But also the information that doctors are using to make clinical decisions are based upon these industry-sponsored trials where they keep their data commercially confidential, which ultimately means that the safety and the benefits are grossly exaggerated.
Yeah, John Abramson explained to me how peer review is done on trials that are coming straight from pharmaceutical drug companies, that you don't really get access to the data itself. You get access to the pharmaceutical company's analysis of that data.
Yes, that's absolutely true. So
that sounds insane.
It is completely insane. Completely insane.
That sounds so obviously compromised.
It's not scientific,
Right.
really. It's not ethical,
Right.
right? And I'm a believer in true democracy. It's not democratic. You know, when I tell my patients, I have conversations with my patients about this stuff all the time, and I just ask them what they think, and they're shocked. Most doctors, even I was not aware of this, Joe, until I really looked into it properly. You know, I was just the conventional doctor doing his job who took the publications in the Lancet, in the New England Journal of Medicine, you know, as gospel truth, biblical gospel truth, never questioned it. And now, you know, I look to people like John Ioannidis, who you may be familiar with. So he's a professor of medicine at Stanford. He's the most cited medical researcher in the world. You know, he's considered a medical genius, very high in scientific integrity. And he wrote a paper, 2006, I think it was, in PLOS One, which was entitled Why Most Published Research Findings Are False. And one of the things he writes in there with his own mathematical modeling of the reliability of research, and this is fascinating, he says, the greater the financial interests in a given field, the less likely the research findings are to be true.
Wow. So in your estimation, is this just a fundamental aspect of unchecked power and influence where the industry exists primarily to make money? They provide these drugs, many of them are beneficial, but their overall goal is not public health. Their overall goal is making exorbitant amounts of money. They have a responsibility to their shareholders. They have a responsibility to the corporation, and that responsibility is to make more money. And they will do what it takes to do that, including compromising physicians, compromising researchers, compromising journals, and that this is just there's not a lot of recourse for the person like yourself that steps out. You stick your neck out there and you get attacked. And fortunately for you, you had all your bases covered and the data was so obvious that you were able to survive this. But for the most part, most physicians, most doctors, most clinicians, they don't want to get involved in that. And so they toe the line.
Yep. I think you've hit the nail on the head. So let's give it some context here as well. So yes, legal responsibility to provide profit for shareholders, not to give you the best treatment. But the real scandals are that those with a responsibility, Joe, to scientific integrity, academic institutions, doctors, medical journals, collude with industry for financial gain. And quite often, and I know you discussed, you know, in detail around the whole Vioxx scandal with John, but quite often the way that these big corporations operate as legal entities, I'm not pointing fingers at people within them. You know, I met Pascal Sauteris. I had dinner with him, who's the CEO of AstraZeneca. You know, he even sent me a book afterwards, you know, to my home address. He knows where I live, so I better be careful. But he seemed like a nice guy, right? But in their roles, they are only responsible to their shareholders. But the problem is, and we see this historically, is quite often, and Dr. Robert Hare is a forensic psychologist who was behind the original international, we call DSM criteria for psychopathy. And he says that as these legal entities quite often in the way they conduct their business actually fulfill the criteria for psychopath. So callous unconcern for the feelings of others, incapacity to experience guilt, deceitfulness, conning others for profit. And we have precedent, we have history of that. Between 2003 and 2016, most of the top 10 drug companies paid fines totaling about $33 billion for illegal marketing of drugs, hiding data on harms, and manipulation of results. And and when those crimes were committed, in most cases they end up making more profit from sales of the drugs than they do from the fines.
Like Vioxx.
So there's no incentive to stop doing what they're doing.
Right.
And ultimately, the patients suffer. But I don't want to throw the baby out with the bathwater here, because someone might say, well, hold on, Dr. Malhotra, but aren't the drug industry responsible for all these life-saving treatments and blah, blah? And yes, they are. But the question is, what is the net effect of them? So if you look at in the last 20 years, so I'll just give you some examples here. Between 2000 and 2008, of the 667 drugs approved by the FDA, only 75% of them were found to be copies of old ones. So the drug companies will change a few molecules here and there on an old drug, rebrand it, rename it, patent it, make lots of money, and then they move on to the next one, right? So there's huge waste. Only 11% of them were found to be truly innovative, as in a therapeutic clinical benefit over the previous drug. So there's all this waste. In France, something similar. Between 2000 and 2011, of almost 1,000 drugs that were approved by their regulator. Again, most of them are copies of old ones, but about double the amount of drugs, Joe, 15% of those drugs were approved, were found to be more harmful than beneficial, compared to about 8% that were therapeutic benefits. So what does that mean when you look at it in its totality with the waste and the harm? The overall net effect of the drug industry, in my view, on society in the last 2 decades has been a negative one.
Wow. That's hard to swallow.
And one of the reasons it's hard